wanted to come on here quick and talk about postoperative care today because if you've been watching my videos, many of you know that we are living it in my household. So for those of you that don't know me, my name is Heather. I am an occupational therapist and a certified hand therapist. And what does that really mean? It just means that I specialize in treatment of injuries in the upper extremity, and I help people get back to doing the things that they love, and I really work at that in a holistic manner. But we're talking about postoperative care, and I know I talked a lot about what I did with my son pre-operatively. So he had a wrist surgery. He's not here at the moment, so I can't use him as a guinea pig. I did a lot of stuff with him pre-operatively, which helped him during his surgery and after his surgery to the point where he did not need any pain medications whatsoever. So I do a lot of energy work as well, and I did a lot of that with him pre-operatively, and that was a huge help. Huge help. Not one pain medication went into that child's body, which is huge given he had orthopedic surgery, and it's essentially construction in your body when you do orthopedic surgery. So anyways, but postoperatively, I want to talk about postoperative care because I also ran into a friend today who just had surgery. I haven't seen her in a while. And she just had surgery on her wrist as well, and she was kind of lost postoperatively. So I think what happens is that when we're planning our surgeries, if it's a planned surgery, obviously if it's a trauma, then you don't have any time to plan. But if it's a planned surgery, it's really important to go in with pen and paper and talk to your doctor about what to expect postoperatively. What should you be doing postoperatively? What kind of motion should you be doing? What are the most important things to support your healing postoperatively so you can have as little pain as possible and as little side effects as possible? And then what to expect, because I can tell you that over the past 20 years, I've had so many patients sitting across from me at my table say, gosh, I really thought that I would have this surgery and I'd come out and I'd be fine. So that's not a realistic expectation. That's what we want, ideally, in a perfect world. Absolutely. That's why you have the surgery in the first place, is to be better afterwards. But initially afterwards, it usually gets a little worse before it gets better because you have that postoperative issue that comes into play. Surgery is an invasive procedure, so there's going to be issues from the surgery and pain typically from the surgery under normal circumstances. So it's important to kind of get a feel for what to expect. So when you are post-op, it's really good to, if you haven't gotten that information from your doc beforehand, try to call him and get that information from him, or seek out a therapist. It's worth the wait of it. It's just worth the price that you pay is to go see somebody to really sit down and get clarification with you so that you can have one-on-one expectations of how you're going to work through things. So I think that's really important too. So no matter what your diagnosis is, sit down with a therapist and talk to them. Go have one visit with them postoperatively and say, okay, this is how I'm feeling. What should I expect? So just like with this person that I saw today, she's, almost at the point where her stitches are coming out. She's still in a sling and she's complaining that her shoulder is killing her and her elbow is killing her, and she had surgery on her wrist. So there's no need for her to still be in a sling, all right? And her fingers are all swollen and puffy because they told her just move. So this is what people tell you to do a lot of times, but that is not what's going to help get rid of that swelling mechanism and that's happening in your hand. So there's very specific things that you can do to help yourself postoperatively so that initially when you're in that post-op dressing, right, you want to be moving the body parts that are free for you to move. So like for her, it was her fingers from here down. She was free to move. She was free to move the thumb tip. She was free to move the elbow, and she was free to move the shoulder. But because she wasn't doing any of that, because she didn't know, right? So she was getting stiff. She was getting shoulder pain. She was getting elbow pain. Her fingers are swollen, all right? So she needs to be doing some of these things. So the just move doesn't really mean anything. When you come out postoperatively, you want to have a little bit more guidance as to, okay, well, what does that mean for me? What can I move that's safe? And how can I get rid of the swelling as quickly as possible? Because swelling in the fingers is like scar tissue just waiting to happen. You want to get it out of there, and you want to get it out of there fast. All right. The other thing is really focus on taking care of yourself. Make sure that you're eating well. Make sure that you're drinking lots of water, hydrating yourself. All right. And then also calming your nervous system as much as you possibly can. So, a happy, calm, centered, grounded system, energy system, is always going to respond better than a stressed, anxious energy system, okay? So whether you do meditation, whether you do energy work, any of that stuff, just you want to keep your energy system and your nervous system as calm as possible, because that's going to equate to less pain. It's going to equate to less hypersensitivity, all right? And it's going to equate to a better outcome when you can start really moving and grooving, all right? So key is move all body parts that are not involved and immobilized postoperatively. Keep the swelling down as much as you can. Take care of yourself. Really treat yourself well when you're postoperative in your postoperative care, and be seen by somebody that can help you kind of guide you through this, even if it's just for one visit. Ask your doc, can I go see a therapist for just one visit postoperatively, so that they can answer my questions and kind of help me guide it. Even though you're not ready to start formal therapy yet, there's still many things that they can help guide you and make your postoperative journey easier. So when you get the clearance to move and groove, here's the key. This is my struggle in my house. Compliance with your home program, all right? So you go through all the surgery, and then you come out, and then you have to do the work, right? Sorry, my thing is, you got to do the work. So the therapist can only take you so far, right? We're here to guide you. We're here to do the things that you can't do on your own, but you really have to make the commitment. So if you made the commitment to have the surgery, make the commitment to really participate in your postoperative care. So I have a non-compliant patient at home. It's great. Let me tell you, I even put in his phone 5 times a day to do his exercises as reminders. What do you think he does? He doesn't even look at it. So compliance, because you go through the surgery, you want to have the best possible outcome that you possibly can, I think he's going to be more compliant now, because I told him actually how much his surgery cost, and he was floored at how much his surgery cost. So I think he realizes that he's got like a $17,000 wrist. He better darn well do his exercises so that he can get his wrist back. But that's the key. Compliance. Do your exercises. Do whatever your therapist is telling you to do. If you have questions or things get worse, make sure that you contact them. Don't wait. And if you have questions, make sure that you call them. But be compliant and do the things that are going to help you get better, because you went through all that for a reason. You want to have the best possible outcome that you can once all is said and done.